Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Pet Pune. Today I am going to talk to you about IVF in cancer patients. It is also called as oncofertility or fertility preservation IVF. Now what happens is, we know that cancer is spreading worldwide and around 1% of the cancer population is very young ladies and young men who range between 20 years to 50 years of age. That is the reproductive age group. Now these cancers in women can be breast cancers or hematological cancers or blood cancers, and in men as well it can be bone cancers or any other cancer. Now what happens is, whenever a patient who is in her young age, say 28, 30 years, who is just married or who is not even married, is diagnosed with cancer, she has to undergo several, for example, surgery or modalities like chemotherapy, radiotherapy, etc., which basically attacks the growing cells of the body. And hence we know that just as it eliminates the cancer cells, it also has deleterious effects on the eggs as well as the sperms in men. So whenever a patient is undergoing chemotherapy, the oncologist or the fertility preservation specialist may suggest you to freeze your eggs or freeze your sperms prior to chemotherapy. So today we are going to discuss about this protocol. Say we have a 28-year-old lady who is diagnosed with breast cancer who is supposed to undergo chemotherapy. This patient, when she comes to me for preserving her eggs, what we do is we start an IVF cycle for her in case she is married right away without wasting any time. So this particular cycle is known as a crash protocol, in which it can be started from any day of her menstrual cycle, because here time is the most important constraint we have prior to her chemotherapy. She takes injections for 12 to 14 days and we grow her follicles in both the ovaries, which are then retrieved in the form of ovum pickup or oocyte retrieval surgery, of which the mature oocytes are selected. Now if she is a married lady, that time these mature oocytes are fertilized with her husband's sperms with the help of technologies like icsi or IVF, and the baby which is formed or the embryo which forms can be frozen for anything even up to 5 years. If she is an unmarried lady, her eggs are selected and the mature eggs are sorted out, and these mature eggs, which are the baby producing oocytes, are frozen for another few years, may it be 5 to even 10 years more. Now once we have frozen gametes or frozen embryos in our hand, the patient can complete all her modalities of cancer management like the surgery, chemotherapy, radiotherapy, etc. And once she is absolutely free of her cancer disease, maybe even 2 to 3 years after her freezing of gametes, once she is declared as cancer free, that is the time when she can start her family using her frozen embryos. Or if she is an unmarried lady, she can think of getting married and start a family later with the help of using these frozen eggs. So if you are a patient who is a young patient who has unfortunately been diagnosed with cancer in a young age, do ask your fertility consultant about fertility preservation and your oncologist about freezing your own gametes so as to have a own biological child later once you are free of your cancer. Thank you.